Yep. Hey, good afternoon, folks. Hope you're doing well. I think this is our first webinar since the summit, so we definitely appreciate you joining and rejoining us. And if you know, just to reacquaint you, it's the last Friday of the month of May. Time is flying, but that also means that it's going to be a webinar led by our team at SHC. So Chini Uchukwa will be leading today's webinar on Invisible No More, Understanding the Intersection of Gender, Race, and Lupus. And it's been some time, so I'm just going to give you a few little tidbits. If you have a question that you want to ask, please put it in the Q&A box. And if you have a statement, a point of fact, or a point of information you'd like to gather and keep the conversation, put it in the chat function. But I know we have a lot to discuss, so I am just going to go ahead and turn it over to Chinny, who's far better at this than I am, and let her lead today's talk.
Oh, thank you very much, Brandon. You are too kind. Good afternoon, everyone. Thank you so much for joining us today on this very important, very timely topic. And we chose this topic actually in celebration of Lupus Awareness Month, which happens this month of May, as well as National Women's Health Month. So I have an esteemed panel gathered with me today to discuss, to have a beautiful conversation, to have an engaging conversation and informative conversation. And I hope that you all take as much as we can give from this. Again, my name is Chinyoka Chukwu, as Brandon mentioned, and I will give my panelists a chance to introduce themselves, as well as the organizations or they represent and why they are on this panel. Starting with you, Anna.
All right, my name is Ana Yancy Vasquez Newbon. I'm a lupus patient myself, and I am an advocate for lupus and health overall with a few organizations in DC.
Thank you, Anna. Caroline.
Hi, everyone. I'm Caroline Donovan. I'm the Director of Patient Engagement and Education at Lupus Therapeutics, which is the clinical affiliate of Lupus Research Alliance. So we are an organization that really focuses on accelerating research for new treatments for lupus.
Thank you so much. And Samaya.
Hello, everyone. My name is Samaya Curtis. I'm currently a cosmetology student at Bennett Career Institution, and also I'm a caregiver to my grandmother who has SLE, that type of lupus. It's a very strong type of lupus that she has, and I just take care of her. I monitor her, and also I report to her doctor of certain things that been going on with her.
Thank you so much, Samaya. Again, welcome, everyone. We hope that by the end of this webinar, you will understand what lupus is and how to identify the disproportionate ways that it impacts women of color with regards to diagnosis, treatment, and even outcomes. We hope that you understand the role that systemic bias plays, health access, and underrepresentation in clinical trials or research, and how that can exacerbate lupus disparities. And then we also hope to hear and learn from both Samaya as a caregiver and Anna, who's a real patient living with this disease, how their experiences and how that will, we hope that increases empathy on your part as well as awareness. And most importantly, that you take tools from this conversation that engage in advocacy, help us make sure that more women of color are participating in clinical research, and find out ways that you can lend a hand when it comes to leading support for initiatives that advance care for women of color in lupus. Before we begin, I'd like to remind you of something that Brandon said already, to please engage in the conversation by using the chat function and drop questions that you may have in the Q&A box. We will get to those towards the end of the webinar. Before we start the conversation, I just want to level set the discussion and make sure that everybody who's on the call understands first what lupus is. Lupus is a chronic disease where a person's immune system attacks their own healthy body tissue. It affects many symptoms and organs, and usually severe joint pain and extreme fatigue are some of the very common symptoms that patients face. SLE lupus, which Samaya described that her grandma has, is short for systemic lupus erythematosus, and it affects is a lupus that affects multiple organs and systems. It is one form of lupus that occurs in people, but it's also the most common form. Currently, there is no cure for lupus. Patients work with their primary care physicians and rheumatologists over their lifetime to identify therapies that can help to reduce symptoms and immune dysfunction, as well as protect their organs. So we'll start the conversation now. And I'd like to start with you, Anna. Can you tell us briefly about your lupus journey from when you were diagnosed until now? Some of the experiences you've faced, some of the things, challenges you've had to deal with as a woman of color in the American health system.
So my journey started when I was 27, so that was almost a little over a decade ago. When I was diagnosed, it looked like it was an allergy reaction that I was having. I was going to allergy specialist. I was going to my primary doctor because we couldn't figure out what was going on. Luckily, I met a doctor at George Washington that was a allergist, but also had a background of rheumatology, that was able to perform additional testing for me outside the normal allergy testing. And that was the only way at that moment that I found out that I had lupus. And then I got switched from not knowing what was going on with me to actually going to see a rheumatologist. The doctor that I had was great. At the beginning, when I transitioned to actually finding a permanent rheumatologist, it was a little hard because they give you the diagnosis and didn't provide me no information. And I at that time I just started working in the clinical field. So when you think of lupus back then, you thought, oh no, I thought I was going to die. Honestly, I broke down because I had just had my daughter. She was only 2. Because I was not sure what was the role of me having lupus, what that meant. I just went to the worst, and that was the scary situation because it affected me a lot at the beginning because I didn't have an understanding. But then when I did find a rheumatologist that really understood and explained to me, I stayed with her for years, and she was able to listen to me whenever I had a symptom or if something new presented, I felt comfortable enough to going to her. And I think that was the key thing, keeping me in care for all these years, is that I felt comfortable. Then when unfortunately my doctor left, I did experience a little bit of disconnect there because then I didn't feel that comfortable feeling that I had with the provider that got switched over. So that caused me to disengage a little bit. So I went through a period where I disengaged of care because I did not have that connection with that provider, which is a very important piece, I feel. Even me working in the medical field, it is still affected me because I know I tell someone, hey, go for care, stick to your appointments. But when you also go through the situation where you don't feel comfortable, it plays a major impact. Like, and it makes it more relatable when you speak to people regarding the issues that you have faced through the process. But overall, I think the treatment has advanced so much too. It has helped me tremendously because compared to where I was 10 years ago to where I am now,
Yeah,
I can say that education recently, the more education I was receiving, the more information, and the more I felt comfortable in getting treatment, I felt like I was overcoming a lot of the barriers that was created when I had that mishap. So
thank
up
you.
to this point.
Okay, that's fair. Thank you so much. That is, it's interesting to hear your journey, and I hear you when you say that comfortability, trust with the provider that you're seeing plays a big role and can help you get a long way in the process or in the treatment or in the management of this disease. So Maya, I'd like to ask you, as a caregiver, was it similar was the process of diagnosis a bit stressful? Was it a one-time thing? Ada said she had to go to the allergist. She thought she was having an allergic reaction and she went to an allergist several times. Was that a similar way that your grandma found out she had lupus? What was that journey like to diagnosis?
So, my grandmother got diagnosed before I was born. My grandmother is 73. She got diagnosed when she was 24, and they only gave her 4 years to live. So it's everything was by the grace of God, because again, she's still alive and well to this day. But she told me that she wasn't feeling well, and she said she had a fever of 107, and she said that she got on a bus even that she was aching and in deliberate pain, and the doctors did not know what was wrong with her. She was one of the first people that did the clinical trials to see what was going on and to see everything that was happening. I say the similar key stories is that it's about comfortability, because my grandmother still has the same rheumatology doctor from 20 years ago. So I say it's really about who's comfortable with you, because sometimes these people with lupus are going through so much pain. They need somebody that is going to guide them in the right way and also listens to them. So I believe that how they had doctors that listened was very similar. And also everybody, with lupus, they go through different pain, different trauma, different healing levels, mentally and physically. And I can talk more about that as we open up with more questions and everything.
Absolutely. Thank you so much, Samaya. Thank you. So let's bring you into the conversation, Carolyn. Hearing both of them, it appears that lupus manifests differently for different people, and that people's road to diagnosis may be different. But talk to us a little bit about what the data says, with women who are living with lupus. How does it affect them biologically, socially, systemically? What does the data say?
Absolutely. First, I just want to thank you both for sharing your stories and your experiences. And I think, the difficult diagnosis and journey to diagnosis is often the norm in lupus. That so often we work with individuals where it's taken them so long just to get an answer. I think, what with lupus, you also said it, you also commented on how it is such, the disease varies a lot, and how it impacts and manifests can really change from individual to individual. And so, there's a saying in sort of the lupus world, like when you've met one person with lupus, you've met one person with lupus. Everyone has a unique experience. And so I think that there are, while the exact cause of lupus is not known, it's sort of thought still today to be a combination of genetics, environmental factors, and hormones. But we do know that women are disproportionately impacted by lupus. So 9 out of 10 individuals that are living with lupus are women. And we also know that women of color, particularly African-American women, Latino, or African-American individuals. I default to saying women since it is 9 out of 10, but I don't want to ignore the men that have lupus when I say that as well. And Asian individuals have a 2 to 3 times, they are 2 to 3 times more likely to develop lupus than white counterparts. And they also tend to develop or have a higher morbidity and mortality from the disease. And I think a lot of that comes into play is the systemic challenges and the social challenges and the biases that we spoke about. Often we hear stories of individuals of color who their diagnosis is very, very delayed. They are, being dismissed as it be, especially women of color, of childbearing age. Doctors can be dismissive and say, oh, that's stress. Oh, you're tired. Oh, you're just complaining. Things like that, instead of actually looking for, the root cause of things. So it can take an individual going to so many different doctors just trying to get an answer. And all those negative experiences can also cause an individual to sort of take a pause in trying to seek treatment, as we just heard. I think so. There's also, unfortunately, in terms of, systemic issues, being treated when you're going to the emergency department. Individuals of color are not always treated in the same manner that other individuals are. We have, I've worked with a number of lupus patients who have, expressed that when they are, when they went to the emergency department, they were treated as an individual, drug-seeking behavior. And that was what they were labeled. And so they then, didn't want to engage in the healthcare system. So I think, I think that again, while we don't know what causes lupus entirely, there definitely is a, body of evidence that really is underscoring the impact and the substantial impact of social determinants of health on SLE lupus outcomes.
Thank you so much, Carolyn. That's very helpful. So it's out there, right? That there are all of these challenges that make it more difficult for women of color to engage in healthcare systems or even to be diagnosed, right? Sometimes they have to keep going to the same doctor. Sometimes they have to change to get second opinions. So I'd like to ask you, Anna and Samaya, has that been your experience? Was your diagnosis delayed? I know, Anna, you said you had to go to an allergist, and then if it wasn't delayed, or when you did find out that you had lupus, what's the experience been like? Carolyn talked about all the challenges that women of color face, both systemically, because of where they come from. How has that experience been for you? Can you personalize that experience as someone who's living with lupus?
It was a little frustrating at first, because one, when they're not sure, they're almost sending you to different departments to say, well, try this. Okay, well, if it's not that, try that. I think I spent a little bit over a year, because for the first year, through my symptoms, and I had I started with the skin condition, I was breaking out in hives, all through my body. And that was miserable, because once that started, it just ran through my whole body. And I couldn't find comfort. They were like, oh, it's, try Benadryl, try Claritin. I tried everything, but I'm the one that was feeling it, and me waiting, even now with specialty appointments, it does take a few weeks before you're able to get in to be seen. So if one area you're not diagnosed properly, or it's not that, then you have to wait now again to go back to your primary, like, hey, this is what they told me, now what do we do from here? So for me, my diagnosis, I think, took almost 2 years, because I went from allergy, I went to dermatology, and then, like I said, until I hit that one specific doctor that was able to have that background for me, that was like, okay, well, it isn't this. Well, let's try this. And I remember the many blood samples that I had to do that one day specifically, when I was able to find the answer. But during that time in between my diagnosis, it was a little frustrating, because I couldn't get relief for what I was feeling, and it was like, we don't want to give you too much, because we don't know what it is exactly. But at the end of the day, I was the one that was suffering,
Yeah.
So, and even now, sometimes too, you say, for example, for me, mine's is more like joint pain. And when you tell them, hey, this is what I feel, they're like, oh, take a muscle relaxer. Sometimes some providers like, take a muscle relaxer. It's going to work for you. But, when you say, hey, listen, this is what I've been trying, is sometimes you do feel like you're being dismissed, like, oh, well, you're not really doing like what you're supposed to. I've had many of experience like that I've tell them, hey, I've tried this, but it does not work, but it's almost like, well, you probably didn't do it right, And and it doesn't necessarily mean that I wasn't doing it right. It's just not working for me. So I have been through that phase also, that I've been felt dismissed at times when I was bringing up my concerns about pain.
Okay. And in fairness to the health system and to providers out there, not to say that every one of them is bad or biased or not doing their work properly, because lupus is one of those diseases that sometimes needs multiple testings, multiple blood tests to identify. So they may not think about it. And like Anna pointed out, if they don't have the background in rheumatology or have never encountered someone like this, they may not be thinking about it, especially if it's presenting for the first time in the patient. But Anna, you said you felt dismissed sometimes. What do you think could have been done differently now that you look back at it? What are some, if you can think about some cases where you felt dismissed, what do you think the providers could have done differently in those situations?
I think having a conversation more so, I think would it, even if you couldn't give me nothing, if we would have had a more deeper conversation while I'm sitting in front of you as your patient, um, and not be so dismissive, I would have even understood, hey, maybe this, we need to take it a little slower. We probably need to look at a little bit more into this. But when you come in and, like I said, and like you said, this is not all the providers, because I have not has been every single provider, no. But there, the providers that do come in and just say, no, well, this didn't work with, I feel like a lot of that could be handled as long as we have a nice conversation, like, hey, okay, well, let's, we couldn't do this now, but maybe let's try and do something different, just make me feel engaged. And I think that's another part, is that as a patient, I want to be felt like we're engaging in a conversation that's going to benefit both of us, me as a patient and you as the provider. I
Absolutely.
don't want to leave out the office feeling like, what was my purpose of coming today,
Yeah.
So I think that's very important. Just make me feel part of the treatment, that we're coming together, even though you may not be able to give me something today, but at least make me feel that we're working towards something.
Yes, yes, that you've heard, that your opinions are important as well, right? That whatever decision you reach, whether it's to continue or stop taking the medication, but it's a shared decision. Is that fair?
Correct.
Absolutely. Thank you so much. Samaya, as a caregiver, you said your grandma has been with the same provider for over 20 years now. Are there still some ways that you feel like there are barriers to her accessing care, resources, support in this with this disease?
Yes. So, um, I also wanted to say something, which is crazy. My grandmother also got lupus right after she had my dad, as a so I'm trying to figure out if there's like some type of connection with childbirth. But back to the question that you asked, basically she has to go to different doctors all the time, and that's because of what lupus did to her. So she had to get many hip replacements, total knee replacements, she had to have spinal surgeries, and it's because, again, like Anna, and thank you again, Anna, so much for your story. I appreciate you for saying your story. Um, like Anna, my grandmother suffers a lot of joint pain, and with joint pain, she tells me it comes with weather. So if it's sunny, her shoulder hurting. When it's raining, her knee and her ankle hurting, and
Hmm.
also it's a whole bunch of stuff that happens with her, and it also causes her to swell. Now with the swelling, she gains about 100, I said not 100, I mean 10 to 20 pounds of fluid on her body daily. And that makes her have to go to a different doctor just because of that. Because first they think it's a gout, but then they realize that this is something abnormal in your body because of the lupus. So it's so much things that have to happen with different doctors, taking her different places. And yes, she did have the same rheumatology doctor. What he does that makes her feel special is that he do touch her. He not in that type of way, but like he rub her. He like, oh, let me feel your knee. Let me, oh, do this hurt? How does feel? Oh, let me get this kit. Let me do this, because my grandmother, she really wants to feel engaged. And she's that type of person. She's real regal. She's like, oh, they not for me. Because she did have another doctor that just looked at her and asked her questions and walked out. And she said, oh no. She said, oh no, I don't like this doctor. And it's because of the connection. It's about the commitment. She don't feel the commitment like, okay, I want this doctor wants to solve this with me. She didn't feel that. So it's really about the connections and about all types of different things. And also something about my grandmother, because of lupus, is depression. She's very depressed at times. And we need to get her like I want to get her a therapist, but I have to let her grow into that. But it's just about the different types of places that she needs to go just so she can heal mentally and physically.
Absolutely. Thank you so much, Amaya. So it sounds like there are challenges. Some of it she looks like she's been able to walk through by finding a good rheumatologist who deals with the core of the problem. But sometimes she doesn't get that rapport or engagement with the other physicians that she sees. And then it also sounds like she's not quite ready to get into some spaces like the depression space where she can handle that part. Okay, fair enough, fair enough. All right. So Anna talked about discovering she had lupus right after she had her baby. And then now Samaya says that there's her grandma seemed to have developed lupus as well after she had her dad. Caroline, can you talk to us about some of the triggers for lupus, some of the causes for lupus, and is there anything related to lupus and childbirth by any chance?
So a lot of this is still unknown and being researched and explored. I do think that we anecdotally, I have also met many individuals living with lupus who were diagnosed either during pregnancy or right after pregnancy. And so I think, and we also know that pregnancy, there's definitely a connection between pregnancy and lupus, in that, we also know that pregnancy can be quite difficult and even hard for individuals with lupus to potentially get pregnant. So I think again, that's sort of the hormones that are being studied and looked at. I think that, another major trigger is stress. And I think that is something that, when individuals, particularly women of color living in America, experience a lot more. And that definitely impacts the ultimate health outcomes and is relevant to the ultimate disparities. There can also be relationships to infections, comorbidities, and lupus. And so I think that, this answer, I don't have a sort of set answer to this, because I think this is something that is really, beginning to be a little bit understood. But because of how heterogeneous lupus is, it is so hard to sort of study this. But I know that there are a lot of efforts sort of including, biorepositories and registries to try to better understand lupus and its causes. So hopefully we will learn more about that and have an answer one day.
Absolutely. Thank you so much, Caroline. All right, I'm coming back to you, Anna. You said you work in the healthcare space. You've lived in lupus for a little over 10 years now. Would you say in your experience that you feel that women of color are adequately represented or prioritized when it comes to research, health messaging around lupus? Yes or no? If yes, why? If no, why? So basically, tell us whatever answer you choose, tell us what's supported with maybe examples or why you think that's your answer.
I'm gonna say no.
Okay.
Only because lupus is not a common disease that is discussed in the healthcare field. It's not as common as diabetes, not as common as high blood pressure, which is typically some of the standard of care that a lot of clinics focus on. The other part I say no is because it also has a lot to do with cultural stigma, thinking, nah, it's just a little ape. and I've heard that at the beginning when I was looking, just take a Tylenol. Just, you know, um, it's going to go away. In my family, me being diagnosed actually helped two more additional members to find out exactly what it was. So they didn't have to go through the whole process of like trying to figure it out because they had literally almost the same symptoms I was having. So, and they even started younger than I was. I was 27. One of my cousins was 14, and she's had it more aggressive than I did. Then I had another cousin that was 18. Not so aggressive, but the thing is, because it's not really explored or really talked about in clinics or potentially provide education, it's not um, as seen as other health conditions. Then, sometimes I think when I have seen flyers for lupus in clinics, it just makes me, it makes you kind of associate your symptoms with that. Like maybe I should talk to my doctor about this. You know what I'm saying? Because I have these symptoms. I didn't have that luxury at the beginning because lupus was not really talked about. And I'm glad that I was able to be at least one of the first in my family to actually go and do testing and actually go through the process of being evaluated and come back that I actually had lupus, because now I'm able to help other people with similar symptoms and also within my own family, like, hey, this is not just the ache and pain, really get evaluated for this. So I
Yes.
think if we had more representation, more education available, it would really open a lot of doors for people to really wonder, like, hey, maybe I should really look into this.
Okay. Okay, fair enough. Thank you very much. And I'd like to say at this point that that's why we at the National Minority Equality Forum are grateful for partners like Biogen and the Office of Minority Health that have given us the opportunity to participate in projects like this webinar, and projects with Faith Health Alliance and Health Champions programs, participating with people like Caroline and Anna to create resources, curate messaging for especially people of color around lupus and clinical trials. So thank you, Anna. We are working in this space to make sure that education messaging is particular and targeted towards the populations that we represent. So Maya, I'd like to ask you, as a caregiver, are there ways that this lupus has affected you indirectly or directly? And what has helped you the most? What kind of support have you received? And also, I'd like to mention that Samaya is a member of our Health Champions group, one of our programs in communities that help educate others too about diseases like lupus.
Yes, and I'm gladly to be one. Um, but let me tell you things that happen with me. It makes me very empathetic because my grandmother, she I don't know why, but she knows how to explain her pain to me, but she can't explain it to the doctor. So, I don't know, maybe mm, I don't know why, but she knows how to explain it down to the T, and sometimes it even makes me feel the pain, like I can feel it
Mm,
in my hip or something like that. But it really opens my eyes. It tells me that every single time that pain happens, it can trigger somebody emotionally. Because sometimes she be having a pain, but she's like, laughing at it. Sometimes she's crying at it, and it's something that like I can't do. I can't really help her out with. Um, but something that the doctors do try to tell her to do is to go take muscle relaxers, like Anna said, but it helps her, but only for a little bit of time. So, what I normally try to do is do mental health days for me and my grandmother. Because it is joint pain that she mainly focus on, I make her a magnesium butter. And I try to rub her down with magnesium butter. I also clip her toenails because that's something that happens to her. Like when she tries to walk with her cane, her toes like it's an abnormal growth of toenails because of the stuff that she's going on. I just do self-care days, spa days, and for both of us. And I get her some good food. It kind of helps me as well because I know that I'm healing my grandmother, somebody that when I was young, I didn't know that she had all this going on until I was probably in my teenage years. But she did so much for me as I'm growing up. And now I just feel happy that I can return the favor to her.
I know she's glad she has you as a granddaughter. Thank you so much, Samaya. And I hope you can continue to have those spa days and relaxation days with her for some time, to come. Caroline, talk to us about how delayed diagnosis and access to care can affect lupus outcomes. So we hear all these delays to diagnosis. How does that play out when it comes to outcomes?
Well, I think, unfortunately, a lot of time, if your diagnosis is delayed, you can be diagnosed at a much later stage of the disease. So, for example, you can be diagnosed when you already have lupus nephritis, which is when lupus impacts your kidneys, and you can be in stage 4 kidney failure and just getting a diagnosis, as opposed to if you were diagnosed before it started impacting your kidneys. I think that also, this again relates back to disparities in access to health outcomes, because often individuals of color are diagnosed at a later stage than other individuals. And I think so that demonstrates again the inequities in sort of accessing healthcare or appropriate healthcare, and doctors that truly understand lupus and are aware of lupus and consider lupus as a potential option. A delay in diagnosis very, very, very broadly, it increases morbidity and mortality for those living with lupus.
Thank you. So it's important that we get the word out, get the education out, get people to ask more questions at doctor's appointments to figure out earlier if they need to do tests that can confirm this disease. Thank you so much. And now let's go a little bit into the clinical trial research space. So far, are we seeing a lot of women or even women of color represented in clinical trials? Yes, Caroline, please.
Missed that part. No, we historically have not. I think that it is true across the board, across different therapeutic areas, that individuals of color are not represented in clinical research, and lupus is no exception. I think the latest data that I have seen states that Black individuals make up 43% of lupus cases, but they account for just 14% of clinical trial participants. There's actually also in that same study demonstrated that since 2006, the participation of Black individuals in lupus clinical research has actually been decreasing as opposed to increasing. And again, that was from a couple of years ago, that article, but I think that, that should sort of demonstrate lupus as well. If you look back at sort of what treatments are approved for lupus, there is one treatment that was approved for lupus, and the company actually had to do post-marketing studies specific in the Black community because there were not enough individuals that identified as Black in the original trial. And so in order for them to, be able to say the medicine was, safe and effective for everyone, they had to do that. And so I do think now there is a push, there's a focus on ensuring representative participation in research. But I think, overall, there's not, and there are so many factors that go into that. I think, we have done some informal informational gathering surveys. And so, people of color are willing to participate in research. It's just a matter of if they are asked, and often they are not asked. And there's a variety of factors and reasons that go into that. And also there's, awareness and education about the importance of representative participation in research is another thing that is so critical.
Thank you. So I just want to ask Anna, and I'm not going to ask you this, Amaya, because you say your grandma already participated in clinical trials. Have you ever been asked about participating in lupus clinical trials? And would you consider it, or would you recommend it to one of your family members who you already said has a diagnosis for lupus?
That's funny. I have not been asked to participate in a clinical trial. I have not. That is actually funny. I really never really thought about it myself. But I would participate only because I know what I know, and I'm a little bit more aware of the importance of the clinical trials. Um, and definitely, I would encourage, um, you know, patients or family members that are going, if they have the opportunity to do so. But mm, my thing would be, me personally, I like transparency. So I want to know exactly what we're doing, what would be the outcome for me, and even for other patients, like what would be the benefit afterwards if this really works for them? Could they continue this treatment? Because the worry is that I do the treatment, I get something that's working, but I cannot continue after this. And it could, then it goes into an array of different things, that for me personally, I would think too, like the cost of the medication. Will my insurance cover it? Will it need a prior authorization? Will it need additional testing? You know, um, but just to say, I would love to participate. I have not had the opportunity to be asked to participate, and I would definitely encourage it, because we want to see more representation, because the way things affect me could not probably affect my counterpart, um, you know, from another race. And I want to make sure that the benefits that would benefit for someone in my demographics would be able to also benefit from that trial, and just across the board for everyone.
Okay. So something caught my attention when Carolyn was talking. She talked about the fact that clinical trials are very important because we want to make sure that the medications that are approved for this treatment, for treatment of lupus, are safe and effective for all people. That's why we need representation for all people. And here's Anna, who's lived for 10 plus years with lupus, and she says she's never been asked that question. Do you want to participate in lupus clinical trials? I think that's interesting, and I'm going to take that as a piggyback to ask a question that someone put in the chat. Please, I see that while we were talking, some hands were raised. Could you please put your questions in the Q&A box? That's the best way that we'll be able to address them, or your feedback. Thank you. So Marcia saying, thank you for all your contributions and stories of lupus. I hear a lot of trust factor between the medical providers and patients. This is something we encounter in most chronic diseases, like the field she works in Alzheimer's. What are we doing, or what are you doing to educate the medical provider space to have them understand the importance of trust building and inclusion or engagement for the benefit of patient-doctor relationship? I'll give you a chance to answer that, Carolyn, because you're the expert here. But I'd like to talk about what we're doing at SHC. We've had a couple of education sessions with doctors through Lunch and Learns. We have a lupus and clinical trials communications toolkit that we use to do this, where we address what the disease is, what the disparities are, and we try to curate resources that we share with them. We also have conversations about including clinical trials as part of treatment, not just as last options or last resorts for people who are living with lupus. And so we're hoping that these conversations that we're having are stirring up in their practices opportunities for them to have these conversations, to ask people like Anna about participating in clinical trials, to offer that option to all of their patients, not just those who they have tried several things and nothing seems to be working for. Because one thing we want to avoid is what Carolyn pointed out, late stage diagnosis, where patients have increased mortality rate because the disease was discovered very late. So I'll throw that back to you now, Carolyn. What are we doing? How can we continue to have these conversations? What are you all doing at Lupus Therapeutics to make sure that these conversations are happening with doctors to ensure trust building between them and their patients?
Yeah, it is such an important topic. And I think one that, again, requires there's multiple approaches. So I think one thing, we have actually a network. It's called our Lupus Clinical Investigators Network, which is about 60 sites across the US and Canada that we work with and partner with. And we are very fortunate that some rheumatologists in that network really excel at the provider communication, the provider trust, understanding and meeting those living with lupus where they are. So we look to provide, healthcare provider education, inclusive of topics such as this, the importance of building trust, the importance of cultural humility in treating individuals. And, this is lupus, but this is also more just, advice for any healthcare provider in general. It would be good for them to do that. I think we also are looking at and supporting developing sort of the next generation of rheumatologists that are focused in lupus, and helping to support that there are more representative, that there's more lupus providers that are representative of the community that is most impacted by lupus. And so I think that's some stuff on the healthcare provider side. And then I think we're also doing a lot on patient education and patient empowerment. And so we have our PALS program, our Patient Advocates for Lupus Studies program. But really the goal of that program is it's education about the importance of clinical research, but also empowering individuals to feel comfortable approaching their healthcare provider about clinical research. So we know that individuals are, and especially individuals of color, are not always asked to participate. And that may be there for a variety of reasons. Providers may be busy. They may not have a trial, but we know that there's also implicit biases and things like that. And so we focus a lot on making the individuals feel comfortable bringing up to their provider potential participation in lupus, and as well as if they're actually in lupus research, and if they're considering a trial, also being comfortable bringing up some of the challenges that might prevent them from participating in a trial. So, for example, a lot of trials are difficult, require a lot of visits to the doctor, but there are things like transportation assistance, childcare assistance, elder care assistance, all of those things that are provided. But not every individual knows even that you can ask about that. I think that there is, many individuals might just say, no, I can't do that, because who would think to tell your doctor that, like, oh, I could do that, but I don't have childcare. That, that connection isn't really something that everyone thinks of. So it's, again, educating individuals that it's okay to ask those questions. It's okay to bring up research, and it's okay to bring up potential barriers that you might have to participating in research, because there might be some solutions.
Absolutely. Thank you so much. So yes, it's educating the providers, like she said, and like I pointed out with our toolkit, which Leslie has graciously put in the chat box. But it's also educating our communities, right? Meeting people where they are to do the education. We do that through our church network, the Faith Health Alliance, which has representation almost in about 25 states at this point. We do that through folks like Samaya, through the Health Champions program, letting people share their stories, letting people talk about the barriers, the stigmas related with lupus, and having experts like Caroline and others coming to answer clinical questions that people have. And just like she said, empowering them to be able to ask questions when they go into their doctor's offices about clinical research. Is it good for me? Can I participate? And are there things that can address these barriers that would stop me from participating, so that they can effectively be a part of clinical trials? Thank you so much, Caroline. So back to you, Samaya. I want to find out from you, so far, you've been such a great help to your grandma. Generally speaking, on behalf of all other caregivers, would you say that you feel that caregivers are recognized when we talk about these conversations, whether it's about lupus or lupus clinical trials? Do you think that caregivers are part of the conversation? And if not, what do you think needs to change?
So I feel like we are recognized as, a caregiver, but in the space of lupus, not really much, because they don't have training for people that, want to be a caregiver based off lupus. They have training for people that, if you want to be help somebody that, broke a bone, or, help somebody that has diabetes, but they do not have any type of trainings for caregivers for people with lupus. You just gotta, if your patient has that sometimes there's really nothing that you can do, except, research on your own and, ask other people for any type of, question, comments, and concerns that you have. Um, but I say that what we do need to do is vocalize about how we need training on like what to do when these people are feeling so much in pain. What I do is like I have to make up my own remedies. And I just look up certain stuff, ask my grandma, how does this feel? And that's literally what I do. Also, I did try to talk to her doctor before about becoming her official caregiver, but it's so much, and that's another thing. We're not recognized as something as, oh, a lupus patient actually do need a caregiver. That is something that's true. They was saying that she really don't need a caregiver. They was saying, oh, do you drive her to her appointments? I say, yes, I do a lot for her. I cook, I clean, I do so much. And they were just in awe, but they didn't really take it in and recognize that like I'm a real caregiver, even though this is just my grandmother. Like I am supposed to be doing this for her, but at the same time, people are out here doing this for people that they don't know, and hopefully they're getting properly compensated, but they really do need the proper training. And I feel like we just need to speak up.
Absolutely. Thank you. And that's why we're having conversations like this, right? To make sure that folks know how big of a role people like Samaya play in the lives of people who are living with lupus and should be recognized, should be part of the conversation because they're the ones who have to deal with the patients when they have those symptoms. They're the ones who have to support the patients when they have those symptoms. And so how do we support them? What resources do we need to equip them with to make sure that the work is easy for them and that ultimately the patients have a better chance of having less pain, less fatigue, or less of whatever symptom it is they're going through at that time. Thanks, Amaya. All right. So I'm going to come back to you a little bit more, Caroline, because we're still talking about clinical research, right? What are some promising partnerships? I know you gave us some, but are there other promising examples of partnerships between researchers and communities now that are helping to advance lupus care and awareness?
Yeah, so I think there are, as I said, yeah, I mentioned our PALS program. I think another program that we are piloting right now is our project Change. And that stands for Community-Based Health Action Network to generate trial participation and eliminate disparities. And so that is actually a program that we're using community-based participatory research to really to address some of the systemic challenges that contribute to the lack of representative participation in lupus trials. We are piloting it in three communities with 3 academic medical centers. So in Atlanta, Nashville, Tennessee, and Philadelphia, Pennsylvania. I think that what we have really found so far is just the very, very big difference in the communities and where education should take place and awareness should take place in education. So, for example, one community has found a lot of education and awareness activities are useful utilizing like faith-based organizations and partnering with faith-based organizations, whereas another community has partnered with, barbershops and nail salons. And so, and it varies based on the community. I think that overall, it's just so important that we are bringing the voice of those living with lupus to research and to the treatment development process. And so there's a lot of ways that we can do that as well. And not only the individual living with lupus, but also the care partner's voice and provider as well, or care providers voice as well. We can have individuals living with lupus and care partners help to review clinical trials to address how they are designed to ensure that they are accessible to the lupus community, to ensure that they are also will provide benefit to the lupus community. I think there's a lot more focus now on recognizing that those living with the disease should really be partners in conducting research, as opposed to conducting research without ever talking to those living with the illness.
Thank you so much. I thank you. I also put in an initiative from NMQF
Yes.
to support, yes,
Yeah,
people
thanks.
of color living with lupus in the chat. So please look through it. I'm looking through the Q&A. I don't see any questions, so I'm going to go to each of you now and ask you for last words as we close out the webinar. Now it's 12:55. Anna, starting with you, what last words would you have to encourage someone out there living with lupus as next steps, whether or not they've engaged in clinical trials, or just what would you like to say to them at this time?
Just be courageous, ask questions to the questions that you're not sure of, you know, even if you think they're mild. It could be the little things that can make a difference on making a difference in managing your care or even solving something. So just be courageous, you know, and actually take the leap of faith. And even if you may not sometimes feel, like I mentioned earlier, too engaged in the care, but advocate for yourself. And asking questions is the best way to advocate for yourself. Don't just take the answer, even though you feel that that is not for you. And if one does not work, look for another way. So
Thank you.
just keep pushing.
Thank you. Keep pushing. Speak up for yourself. Great. Thanks, Anna. Samaya, last words. Healthcare providers, researchers, other caregivers. What would you have for them? Next steps. What do you have to say to encourage them in this journey?
So for the healthcare providers, I have a few words. I say the pain is unknown only to the person who is looking outside in. And I say that because we do not know how severe these patients are feeling when it comes to what they're going through and this joint pain and discomfort that they're experiencing. And also to those healthcare providers and everybody that is a caregiver, keep it up. I know that it's hard. I know that it's sometimes very stressful. Find yourself a free day, a self-care day, and keep it pushing, just like how Anna said. We're all in this together.
We're all in this together. Thanks, Maya. And finally, Carolyn, final words for especially patients who want to now get involved in research and learn about trials safely and confidently.
Oh, yeah. I mean, I think overall, that just for individuals living with lupus in general, the words are, you know, you are not alone. But also that you know your body best, and are your best advocate. So feel empowered to have those conversations with your healthcare provider. If you are specifically looking for participation in lupus, it is okay for you to bring that up to your healthcare provider. If that provider is dismissive, it is okay to try to find another one who maybe is not dismissive of that desire. I think overall, without participation in research, in lupus research, we will not get better or more effective lupus treatments. And I think that everyone living with lupus would be in agreement that better and more effective treatments are needed. And so I think, again, just sort of setting that fact that you can be a part of that by participating in research, or even if you're not, in a trial itself, you can also partner to have your voice be heard in the drug development process through, providing patient insight and just letting people who are working on the drug developments really understand what it's like to live with lupus.
Thank you so much. Thank you so much for your valuable insights to this conversation. And thank you all for everyone who stuck around. It is almost time to get up now, but if you feel like there's something specific you'd still like to learn about, please reach out to us at shc@nmqf.org. This webinar is recorded and will be posted on our YouTube page, so you can get a chance to listen to it again and to share it afterwards within your networks. Thank you all and have a wonderful weekend. Bye.